Hello, my name is Gio. Congratulations on getting started with your orthodontic treatment. In order to have a great, beautiful smile at the end of treatment, you will need to take good care of your braces. First, let's get you familiar with the most common parts of braces. There are many parts, and as they act together, they will straighten your teeth. The most obvious part is the bracket. Brackets are the individual attachment glued to each tooth. They can either be metal or clear. This is an arch wire. It is engaged into each bracket, and it's actually what delivers the force to move your teeth. This is an elastic tie or O-ring, which is used to hold the wire into the bracket. You will need to change these ties at each adjustment so you can personalize the brackets to your own unique style. Different from an elastic tie or O-ring is a steel tie. A steel tie delivers a stronger force to help engage the wire into the bracket where necessary. Proper oral hygiene is a critical part of orthodontic treatment. As you eat, your teeth and braces collect food, which will eventually turn into plaque if not removed. If plaque or debris is left on or around your braces, it can lead to decalcification or scarring, which is permanent. To avoid this, make sure you tilt your toothbrush down towards the area between your gums and brackets. This is where plaque accumulates the most. Next, you want to tilt your toothbrush under the brackets towards your gums, making sure to brush your gum line as well. Then, with circular motions, brush the tops of your braces. Don't forget to brush the biting surfaces, behind your teeth, and of course, your tongue. Dr. Truman recommends brushing 3 times a day or after every meal for at least 2 minutes. Remember, clean teeth do not decay and healthy gums do not swell or bleed. Your braces and appliances should shine when you're finished. Now, let's talk about flossing. In order to floss with braces, you will need to thread the floss under the arch wire. To do this, you can use a floss threader or super floss. Once you've threaded the floss under the arch wire, make sure you move the floss up and down, hugging each tooth, making a C shape. Repeat this process until you clean in between all of your teeth. This does take a little time and practice, but doing so can help shorten treatment time, so it is well worth the effort. This is a proxy brush. This special brush is used for those hard-to-reach places. Gently place the brush under the arch wire and clean around the bracket. These brushes are also great when you are out and about with no access to brushing. Now that you know how to take care of your braces, let's talk about what to do if you encounter a problem during your treatment. If something happens to your braces, remember, it is usually not an emergency unless it's painful or discomfort is involved. As you are getting used to your braces, you may experience some sore spots on the insides of your cheeks. If this happens, you can use wax to cover the area. To place the wax, take a small piece and soften it in between your fingers. Place it over the area that is causing discomfort. Don't forget to remove the wax before eating and brushing. If you happen to break a bracket or feel a bracket sliding on the wire, call our office and we will get you scheduled accordingly. These appointments often require more time and usually can't be done after school or at your regular adjustment. If a wire comes loose, you can take a pair of tweezers and try to insert it back into the last bracket, or as a last resort, you can clip the wire with a pair of nail clippers. Just be sure to call our office before doing so. Until your mouth gets used to the braces, it is normal to feel a little sore. Over-the-counter medications such as Motrin or Tylenol may be used to help to ease discomfort. Remember to follow the manufacturer's instructions. There are a few harmful habits that can damage your braces and make your treatment longer than estimated, such as chewing on ice, pens, pencils, and fingernails. Picking at your braces can also cause major damage to your wires and brackets, which can result in your teeth moving in the wrong direction. There are also certain foods that should be avoided during braces. Foods that are hard like nuts, hard candies, hard breads like pizza crust, and chips can knock brackets loose. Even sticky foods such as gum, caramel, Skittles, and taffy can cause damage too. Make sure you cut up foods like carrots and apples into small bite-sized pieces and cut any meat away from the bone. Now that you understand everything about your braces, let's talk about how often we will be seeing you. Expect to schedule your appointments every 4 to 8 weeks. Scheduling your next appointment before you leave our office is very important. Waiting to schedule 1 or 2 weeks after your visit complicates the schedule since appointments book 4 to 8 weeks in advance. Postponed appointments are a common contributor to overtime treatment. Don't hesitate to contact our office with any questions about your future appointments. Congratulations! We hope you've enjoyed your experience so far, and let's work together to get that beautiful smile that you deserve.